Hello, everyone, and welcome. My name is Martha Garcia. I am the Director of Swift Health Programs. Today, I expect to only take about 15 minutes of your time to give you a brief rundown on the status and outline of Swift Health Programs, an initiative we have been building at CSUSM. We'll talk about the structure and benefits of the program, which we hope will be a good fit for students you are helping to prepare for graduation, either this year or next. Swift Health Programs officially launched this past summer, and we now have our first cohort of students on campus this fall. We brought approximately 2/3 of the first cohort to campus in July for a 5-week summer bridge experience, which was enormously fun for both the students and for us as staff. We had an opportunity to ask students what made them choose Swift Health Programs, and here's a summary of what they said. They were interested in a program where they had to take only the most relevant classes. So the idea of an accelerated program was very exciting to them. While it's true that the academic pathway is very structured in our program, it's not necessarily less work. It does include all the required coursework for a bachelor's degree. We'll talk a little bit more about this in a minute. They were also interested in the scholarship. We offer students in Swift Health Programs a $4,000 scholarship every summer to help offset the cost of living during the summer term when there is historically less federal or state financial aid available. And third, they were interested in the idea of being job ready as soon as they graduate. This last note about being job ready is particularly important because to us, it means we're transmitting our mission effectively to students. The mission is to help bridge the gap in mental and behavioral health workers, and we aim to do this by getting students the professional experience and training that they will need for the workforce. We do this in collaboration with industry through course-based clinical and community-based internships. The three main benefits structured into the program are the concentrated academic pathway designed to capitalize on the summer months, a period which in higher ed can cause some melt or attrition. The summertime, when and if used strategically, is also a time when students can potentially gain the most value from partnerships with fieldwork sites. And three, students are actively prepared for one of two possible workforce certifications, which will compound their readiness for the job placement after graduation. Important things to note regarding how we've made this program accelerated. A bachelor's degree requires 120 units, so we get to the required course load by supporting students to carry elevated unit loads each semester and requiring full course loads in the summer. So I promised you a deeper understanding of what we're doing to accelerate the degree. This is a representation of what a typical student's 4-year pathway would look like. Students carry approximately 12 to 15 units per semester, and they might have additional units in the summer or additional semesters after the traditional 4 years in order to get to 120 units. In Swift, we support students to carry an elevated course load during their most profitable semesters, and to carry full load of courses in the summer term in order to get the required number of units to the degree in 3 years. There are 2 participating academic degrees in the program: human development, specifically the counseling concentration, and the public health degree. To support community building, students are placed in cohort-specific course sections across degrees for the first year and degree-specific for the following 2 years. Summers, as mentioned, will focus on development and preparation for experiential learning and fieldwork. Regarding the 2 academic degrees, I briefly want to provide some additional notes on each. Human development, for example, many students don't know what human development is, and if they articulate to an academic advisor or similar that they want to be a counselor or a social worker, they might find their way to this degree. But they might be more likely to find their way to the psychology degree, so it's important to sort of unearth what exactly a student perceives as their future. It's important that we do a better job helping the right students to find this degree. We like to tell prospective students that preparation in the human development degree focuses on mental and behavioral health support in a one-on-one or individualized format. The second participating degree is public health. We found there is a renewed interest in this degree, likely brought on by the pandemic and the essential learning that took place during that event. Public health is also a helping framework where students would likely find themselves in direct service delivery, but likely more in a group or collective format. We like to tell students that public health is often about service to the community. When we hear students talk about making large scale change or have a systemic perspective on the work they want to do, we might mention the public health degree to them. Regarding the experiential learning and career preparedness elements of the program, I want to talk here more specifically about how the summers are designed. Many academic programs have a fieldwork component, so that in and of itself is not so unique. But for many of the classic degrees, when they offer fieldwork, it's a one and done. In the case of Swift Health Programs, there are repeated fieldwork courses each summer. This enables students to move to more deeply envision themselves in the kind of work they might do after graduation. It also allows them to early on practice the skills and abilities that will likely make them successful in their careers. Finally, with the knowledge that for most of our students financially in need, they take on summer work in an effort to earn money for the academic semester. We offer Swift Health Program students a $4,000 scholarship to offset the cost of living when they've not been able to work full-time in the summer. I mentioned that there is embedded preparation for workforce certifications. For students in the human development pathway, they will be preparing to certify in the new state of California wellness coach certification. This certification requires a minimum of 300 field hours before graduation and additional hours after graduation. Persons with this certification are anticipated to seek opportunities in mental wellness settings, including the K-12 school system. For students in the public health pathway, they will prepare for the Certified Health Education Specialist exam. Students in human development counseling track earn requirements and hours that would go towards their wellness coach certification. Students apply for the certification through the California Department of Healthcare Access and Information office and website. Wellness coaches will offer non-clinical services that support youth behavioral health and well-being, such as wellness promotion and education, screening, care coordination, individual and group support, as well as crisis referrals in those settings. Wellness coaches can work in a variety of settings, including schools, community-based organizations, and health provider offices. Students in the public health track prepare to sit for the certification exam referred to as the CHES exam through the National Commission for Health Education Credentialing. A certified health education specialist teaches behaviors that promote wellness to improve the health of both individuals and communities. They develop and manage health education programs that help individuals, families, and communities maintain healthy lifestyles. They can test the effectiveness of programs and educational materials, help people find health services or information. A health education specialist can work in a variety of settings such as hospitals, clinics, schools, universities, nonprofits, and even government offices. That is the complete presentation regarding Swift Health Programs and the benefits that it offers students. If you have any questions, I invite you to email them to us at swifthealth@csusm.edu. We're excited to take any of your questions, set up follow-up meetings, or present to your campuses. If you have a future health fair or college and career fair, we'd be happy to table at those events. Please feel free to shoot us an email. Thank you so much for your time today and have a great day.